My name is Meera Shah, Meerashah.
Yes, we can, sure we can change the world.
Welcome to the YALI Voices podcast, your home for sharing the best stories from the Young African Leaders Initiative Network. Be sure to subscribe to the YALI Voices podcast and visit yali.state.gov to stay up to date on all things YALI. Meera Shah has almost 8 years of experience in the public health sector. Currently one of the sub-county medical health officers in Mombasa County, she coordinates activities related to health, including overseeing the running of primary care facilities and programs such as HIV/AIDS, tuberculosis, malaria, mother neonatal child health, nutrition, and disease surveillance. A pharmacist by profession, she is at the moment pursuing a master's degree in health systems management. She is also a 2015 Mandela Washington Fellow.
I am working with the public sector in Mombasa, with the county government of Mombasa in the Department of Health, in the public health sector. It's been 10 years now, this year, and basically what we do is we focus on preventive health and promotive health rather than curative. So we are out in the field mostly to promote good health, make sure children take their immunizations, make sure they're well nourished, and if not, then they're given the nutrition supplements, make sure all our people who are living with HIV are on ARVs, make sure women are on family planning methods, disease surveillance, make sure we have about 20 priority diseases in Mombasa, in Kenya, that we monitor on a regular basis. So make sure that if there are any cases that are reported which are of the high priority, then they are followed up and made sure that we contain any spread of infection and the sort. So basically what we do, we promote good health. Like I said, we promote immunization for children to be fully immunized. We promote HIV in the sense we make sure that all people living with HIV are on their ARVs, and also preventive measures to spread the infection of HIV. Like we have the PMTCT program, prevention of mother-to-child transmission of HIV. Now it is elimination of mother-to-child transmission of HIV. We're talking about TB, tuberculosis, make sure that everyone who has TB is on treatment for anti-TBs, because remember, TB, tuberculosis is curable. Yet we have people dying from TB. And why is that, considering that we have medicines available, but yet you find people are dying of TB. And what is worse than TB is multi-drug resistant TB, and then we have extreme drug-resistant TB. So far in Mombasa, we've got a couple of cases of multi-drug resistant TB. We haven't got any of XDR. Basically, all that part of preventive health. I think a lot of making people aware of good health or promoting good health is a lot to do with education and making the public aware on the impact of not having their children immunized, or on the impact of a young mother not being on any family planning method. It's a lot to do with education and creating that awareness, so that you're creating the demand for good health, for a mother to go to antenatal clinics and make sure that the child or the fetus is progressing well into delivery and all that. So it's a lot to do with education. We are giving a lot of focus now to school health, so that we want to instill good health or make children be aware that they should demand for good health. I mean, remember, children are the agents for change. So we really want to focus on school health and promote health education through the children. But apart from school health, we also go out into the community and have dialogues with communities on everything on health. Like if there are diarrheal cases, then why they should wash their hands before eating food or after going to the toilet, or why they should immunize their children, why the women should go to a health facility as soon as they realize that they are going into labor, rather than going to a traditional birth attendant, and who will probably complicate the matters, and then the mother comes into a health facility when it's already complicated, and either we lose the child or we lose the mother. So it's really preventive health that we want to focus on, going out in the community, making people aware, educating them on demanding for these health services, and through school health, we would like to promote good health. I think that is the best avenue, education and knowledge.
We talked to Meera about how she deals with preconceived notions about health information and care. Having mentioned the use of midwives or other non-clinical spaces for childbirth, we wanted to know how she addresses traditional beliefs about health. We then followed that up with a question about what she considered some of the key elements she employs when developing a health education and awareness campaign.
For us as a country, we have a long way to go. Remember, these midwives, or like you said, the non-medical spaces that are available, they are right in the community. They're very, strategically placed in the community so that they're able to reach the community. Whereas we as a government, as a country, have a long way to reach all those geographical, strategic locations. So until we can do that, until we are able to place ourselves at the right time, at the right moment, at the right place, I believe these non-medical spaces will continue thriving. And for that, there has to be there has to be a policy change to mobilize resources or to allocate resources at the community level, at the ground level, to make sure that a health facility is within reach of a community, so that the community does not have to go to these other non-medical spaces to seek health services. We use a variety of methods. We go through radio as well. We do print. Although realize Mombasa still has a big rural population. Most of Kenya has a big rural population, and not everyone will be able to read and write. So radio, we also do a lot of mobilizing through the public address system. Like we mount a public address system on our vehicles, which go around a village, through all these areas, promoting the message on health or whatever it may be. That being the main avenue, the main channel through which we get the message out. But yes, we do have print media. We have nowadays we are also focusing on the social media. Although again, like I said, it's not everyone who accesses social media. So we try all channels. We also go through what we call the chiefs' barazas. Remember, the chiefs are the village, the elders, the community leaders, and they regularly, on a monthly basis, they have like a get-together in the community where they talk about security issues, whatever issues there may be. And we ride on that because they have mobilized a lot of people. You get about 100, 200 people at such a gathering. And we ride on that as well and get the message out to the people. We also have community health volunteers who are part of a community unit. In some cases, we also support them to get the message out to the community. As YALI network members, I believe we have a huge role to play in promoting good health. Remember, currently, the YALI network probably has about so many people, about thousands, 5,000, 10,000, I'm not even sure how many people we have. But the bigger the group gets, we're able to reach more people. And remember, this is a group of diverse individuals coming from different backgrounds. And I would say promoting good health is not just the responsibility of a medical person. It's the responsibility of everyone. It's the responsibility of guys who are in education. It's a responsibility for guys who are in politics. It's a responsibility for guys who are in other sectors, in the transport sector, in the housing sector. And it's a holistic thing. And so it's when all these ideas come together from different people and we are able to create something good, come up with some good ideas, some good policies that we would able to implement, I think that is what will impact good health or quality health in the country or even in the continent. I'm glad that I had this opportunity to network, to come across YALI, to come across MWF, so that I was able to come across a lot of people from diverse backgrounds. And like I said earlier, it's good that we all come together, we formulate ideas. Everyone has a lot of ideas, but if you're able to put even 2 of those ideas together to impact on the health sector, to impact on the education sector, to impact on agricultural sector, it would go a long way for the continent, for all us African countries. Yeah, it's just coming together.
Thank you for tuning in to another YALI Voices podcast. And thank you, Meera Shah of Kenya, for your insights and ideas. We encourage YALI Network members who are working to ensure that credible health information gets to those in their community to share their ideas and best practices with us. Be sure to share your thoughts on this podcast and other important topics on the YALI Network Facebook page at facebook.com/YALI Network. Be sure to come back for more inspiring stories from young African leaders on the YALI Voices podcast. Join the YALI Network at yali.state.gov and be a part of something bigger. Our theme music is Ego Happen by Grace Jerry and is produced by the Presidential Precinct. The YALI Voices podcast is brought to you by the U.S. Department of State and is a part of the Young African Leaders Initiative, which is funded by the U.S. government. Thanks for listening.